Good afternoon to everybody. We're thrilled to have you here joining us. My name is Amanda Lewis, and I'm the director of the University of Illinois at Chicago's Institute for Research on Race and Public Policy. And we want to welcome you for the launch of our new report, Deadly Disparities in the Days of COVID-19, How Public Policy Fails Black and Latinx Chicagoans. This project started over a year and a half ago. There was some talk in March of 2020, as we all remember, that the developing pandemic was going to be a great equalizer, that we were all in it together, as folks said at the time. But it was clear almost immediately that that was not the case. While no one would escape the impact of the pandemic, the most marginalized and most vulnerable in society were both hit hardest by the disease and most impacted by the economic fallout that followed in the wake of the pandemic spread. As these racially disparate effects started to become visible in Chicago, IRPP partnered with the principal investigator on this project, Dr. Claire Dakota, and a group of local scholars to try to understand what was happening locally and which policy efforts were working. Professor Dakota and the research team for this project worked tirelessly for the last 20 months to launch the project, interview over 150 residents, policymakers, community organizers, public health and medical professionals to understand what happened in Chicago and why. As part of IRPP's larger State of Racial Justice in Chicago project, the report we're releasing today helps to provide details about why Black and Latinx Chicagoans were disproportionately impacted by the pandemic and what we might have done differently to address community needs. Before we get into the substance of the report, I want to offer some important appreciations. First, to the entire research team, and this includes some Chicago area scholars who helped us conceptualize and launch the project early on, including Patricia Macias Rojas, Eve Ewing, Gayatri Reddy, and Anna Guevara. Next, a humongous thank you to the students who worked tirelessly to recruit, interview, transcribe, analyze, draft, etc., all the necessary work to make a report like this possible. This includes particularly Cal Lee Garrett, Cynthia Brito, Fructoso Basildua, Jasenia Vargas, Dakari Finster, and Irma Ramirez. Thanks also to the IRPP staff who've put an extensive effort and overtime on the report to make this release possible. This includes Ivana Arenas, Dina Lewis, and Chris Poulos. A big thanks to our UIC partners who helped fund the project quickly. We didn't have time when this all evolved to go through. I mean, we have applied for external support, but early on it was important to get internal support to make sure we could get going immediately. In addition to IRPP, we got generous funding from the Institute for Policy and Civic Engagement, the Center for Clinical and Translational Services, and support from the Institute for Health Research and Policy and the LAS Committee on Social Science Research, also from the Vice Chancellor for Research Office. And finally, a big thank you to the off-campus partners who have sponsored and collaborated on the report's release. And this includes the Chicago Community Trust, UCAN Chicago, and Chicago African Americans in Philanthropy. A quick reminder that you can download this report now and copies of all our earlier reports for free at our website, which is irrpp.uic.edu. We'll be putting a link in the chat for that. And a few housekeeping issues. We're recording this for those who aren't able to join today. We also want to encourage you and others to join us for a second conversation about the report on the evening of December 9th. So for anybody who isn't able to join us today, please encourage them to go to our website and sign up for that event when we will have partners from several community organizations joining us to talk about the report. You should submit questions anytime during the presentations using the Q&A function in Zoom, which is at the bottom. And the live transcript will be on. You can turn it off anytime if you'd like to. We apologize ahead of time for any errors. It's not always completely accurate. Now, I'm very excited to turn it over to our first speaker, who will be Dr. Claire Dakota, the lead author of the report. She's a professor of sociology at UIC, the author of several award-winning books on the social construction of health and disease, the politics of knowledge production, and people's experiences with healing and healthcare systems. Claire, I turn it over to you. Thanks.
Thanks so much, Amanda, for the introduction and for everything. So I would like to begin my comments today with a story from one of the 100 interviews that we did with residents of vulnerable communities in Chicago. So Maria is undocumented, Latina, and a single mother who has lived in the Little Village neighborhood of Chicago for 15 years. She was working for a mailing company before the pandemic began, but she got laid off early in the pandemic. Then she started working for a temp agency that provided her no benefits. She tested positive for COVID-19 in September 2020, but she had to continue to work. She told us, "The truth is, I didn't want to inform them. I didn't want to leave because I know I'm not a permanent employee. I don't have any benefits." Maria explained how prevalent her situation was in Little Village. She said, "Even if people are sick, they have to work. Who's going to help with the expenses?" And she scoffed at the label of being called essential, explaining, "They kind of take advantage that you can't say, okay, why do I have to expose myself and accept what you guys give me? I am exposing myself, so why don't they give us help? But yeah, they're taking advantage of the fact that you can't speak up." Maria had to leave her elementary school-aged children at home to do remote learning while she worked because she had no family or money to provide childcare. With no savings to rely on, her debt has continued to mount as the pandemic has stretched on. But as an undocumented American, she was ineligible to receive unemployment benefits or the stimulus checks. And she worried about her accumulating debt to her landlord because if she was evicted, she explained to us, quote, "I wouldn't have a clue what would happen if they told me to vacate the apartment," end quote. So this is just one example of the disproportionate impact that COVID-19 has had on Black and Latinx residents of Chicago. Overall, Black and Latinx Americans have died at 2 times the rate of white Americans. And Latinx Americans have had the highest rates of infection throughout the pandemic. So this slide indicates the disparities in cases on the left, hospitalizations in the middle, and deaths on the right by race in Chicago. If you don't know, Chicago is a majority minority city where white, Black, and Latinx populations are each approximately a third of the city's population, and approximately 6% of the city's population is Asian American. In this slide, we see that Latinx communities bore the brunt of the infections. We can see this on the left-hand side, 35% of the infections of the cases in Chicago were among the Latinx population. In the same circle, you can see that Black and white residents had approximately the same amount of cases, but if you see in the hospitalizations and the deaths, the Black population was hospitalized at a much higher rate and died at a much higher rate as well. So this report seeks to understand why exactly this continued to happen throughout the pandemic. In addition to experiencing disproportionate cases, hospitalizations, and deaths, Blacks and Latinx Americans were also more likely to be laid off and to be months behind on their rent. COVID-19 is not only an infectious disease, it has exacerbated the already profound economic, housing, education, health, and mental health precarity of people who are marginalized on the basis of race, class, and legal status. When news first surfaced in March 2020 that deaths from the coronavirus were concentrated in Black communities, and then in April and May that infections were concentrated in Latinx communities, City of Chicago and Illinois state officials responded with data-informed racial equity initiatives. Both Governor J.B. Pritzker and Mayor Lori Lightfoot have dedicated resources to tracking racial statistics on infection and death, reduced barriers to testing and monitoring, and expanded surveillance, healthcare, and vaccination access in Black and Latinx communities. And yet, racially marginalized Chicagoans still experienced disproportionate levels of infection and death, as well as health, housing, financial, and welfare insecurity. In fact, federal, state, and local governments have extended tremendous resources to address health and racial disparities associated with the pandemic. And yet, according to the Chicago residents that we interviewed for this project, the policies designed to help the most vulnerable have not met existing need. And our report sought to explain why. So in our report, titled Deadly Disparities in the Days of COVID-19, How Public Policy Fails Black and Latinx Chicagoans, we report on data that was collected between August of 2020 and October of 2021. sorry. This is a map, of course, of Chicago with highlighting the 3 areas that we collected interviews in. So we interviewed 100 residents of these 3 neighborhoods that were very heavily impacted by COVID-19 in Chicago: Austin, Albany Park, and Little Village. We focused on these neighborhoods because of their socioeconomic, racial, and immigrant composition. So this information that's on the right, and it may be a tiny bit hard to read in such a quick amount of space, is available in the report. So just so you know a little bit about each neighborhood, Austin is a predominantly Black neighborhood, and the median household income is much lower than the average for the city of Chicago. Little Village is a predominantly Latinx neighborhood with a large immigrant population, and the median income here is also lower than the city's average. Albany Park is a more mixed racial neighborhood with a much higher median income than the other 2 neighborhoods and even than the average in Chicago. However, our report explains that Albany Park actually suffered from worse death rates than either Austin or Little Village. And this is likely because Albany Park is also home to a large immigrant population. And Albany Park was not targeted for intervention by the city of Chicago. So in addition to sampling these neighborhoods on the basis of their socioeconomic, immigrant, and racial demographics, we also wanted to audit the racial equity policies that were implemented in the city of Chicago. So we chose 2 neighborhoods that were targeted by the city government for investment of additional resources, and that was Austin and Little Village. And we also asked people about the implications of the lack of investment in neighborhoods like Albany Park. In addition to interviewing 100 residents of Chicago, we also interviewed 45 state and city officials, epidemiologists, healthcare providers, and community organizers. We sought to understand which policies and programming worked and which failed to meet existing need during the pandemic. In the report, therefore, Chicago becomes a lens for critiquing the federal approach to COVID-19, as well as a means of auditing Chicago-specific policies and their successes and weaknesses. In the report, we offer 4 primary explanations for why existing policies failed to address existing need among Chicago's residents. First, decades of discriminatory policies on housing, healthcare, and Social Security, and disinvestment in poor neighborhoods meant that lower income and working class Chicagoans did not have a safety net to rely on during the pandemic. While middle-class Americans with liquid assets and accumulated wealth also experienced, of course, disruptions to their employment, they had safety nets to help them weather financial setbacks. In this slide, we see that 1/3 of Black and Latinx households have primarily no safety net to rely on. Many Black and Latinx households are also liquid asset poor, which we include details on in the report itself. Basically, this slide illustrates how lower income Black and Latinx Americans do not have existing financial cushions, and many face barriers in addition in accessing social assistance, which I'll talk about in just a minute. The Latinx and Black working poor were made vulnerable to infection because they were also more likely to be employed in low-paying front-facing jobs. Nope. So here are some of the demographics of frontline workers in Chicago. On the left, we see the distribution of all workers and all frontline workers. And then to the right of the red line, you can see different percentages of workers by race in different areas of frontline work. And it's very clear from this slide that Black and Latinx workers were overly represented in frontline labor, and many of them also had no choice but to keep working. So here we see that in particular jobs, of course, like public transit, Black Chicagoans are overly represented, and that in healthcare, of course, is where many of the white frontline workers were employed. So this just gives a breakdown of the different places where frontline workers were being exposed to COVID. And the story that I told at the beginning about Maria also starkly illustrates the pre-existing structural inequality and its important negative impact on vulnerable Chicagoans. In addition, lower income Chicagoans of color also suffered worse outcomes because they already faced health insecurity because of pre-existing conditions and lack of sufficient access to healthcare. So this is a slide illustrating the 2019, so before the pandemic, levels of insurance by race. And so we see that Black and Latin, especially Latinx, Chicagoans are much more likely to be uninsured, but also you see the percentage of folks who were insured through their employer, and therefore if one lost work, then there were also disruptions to people's healthcare and insurance coverage. Both Latinx and Black Chicagoans who already faced financial and health insecurity found that existing vulnerability was compounded by pandemic conditions, which led to higher rates of infection, hospitalization, and death. Of course, these conditions are not unique to Chicago, but Chicago's long history of residential segregation and neighborhood disinvestment exacerbated people's existing vulnerabilities. So the second mechanism or explanation that we identify in the report for the disconnect between policy and existing need is that at the federal, state, and local levels, COVID-19 was primarily treated as a health crisis, and it was fought through a series of public health strategies. However, the residents that we interviewed experienced the pandemic as a much broader crisis associated with housing, food, employment, and childcare insecurity. So these next slides are snapshots of how households fared 6 months into the pandemic. And in the report, we actually have a series of these. I'm just going to show 3 of them here, but we have a series of these snapshots of what households by race looked like sort of 6 months into the pandemic, drawing on US Census household pulse surveys. So this is a picture of the households that were behind on rent 6 months into the pandemic. And as you can see, there's a clear discrepancy by race here in who was behind on rent. And also by not only race, but also by education. Oops. This is another snapshot of 6 months into the pandemic. This is Chicago Metro households that have lost income due to the pandemic. So again, we see a clear racial discrepancy here. 65% of Black Chicagoans and 68% of Latinx Chicagoans had lost income due to the pandemic. And then again, here we see the percentage of Chicago area households with childcare disruptions. Again, this is a 6-month snapshot. So we have 24% of Black households and 22% of Latinx households who experience childcare disruptions. So residents that we interviewed told us again and again that while the loss of life due to COVID-19 was of course profound and certainly traumatizing, but there were a wide array of insecurities that people were facing. For example, when asked how the pandemic affected her neighborhood, one Black woman from Austin explained to us, "Within this pandemic, we've had so many other demics. There's a violence demic, there's the losing my job demic. It's just been so many demics to add on, which causes more mental health issues." Dan Fulweiler, who's CEO of Esperanza Health Centers, a series of federally qualified health centers that offer services to residents, regardless of their ability to pay, explained to us that the trauma that residents were facing went well beyond the loss of life. He said, sorry, the slides keep jumping ahead. "There's the trauma from the disease and death, and then there's also the trauma from not having money to pay your bills anymore, because all of a sudden you're out of work. Even if they didn't get kicked out of housing, they were living with the stress and anxiety of not being able to pay their rent. You were traumatized if you had to go to work, and you were traumatized if you got fired, either way." In another instance, one Latinx man from Austin explained that the focus on health issues often obscured the broader crises that his community was facing. He explained, sorry, "We have health issues, of course. Mental issues, mental health, drug abuse, alcohol abuse, domestic violence, crime. Just like the very mask I wear and you wear, that's what's happening. Everything is being masked, masked, masked. Racism is still an issue, undiscussed, again hidden." So as this man suggests, many of the broader insecurities that people were facing were a low priority for federal, state, and local actors. And in fact, if financial and housing security had been prioritized as a preventative public health strategy to protect the vulnerable, then marginalized communities may not have borne the brunt of infections and death. Most housing and cash assistance programs were designed to address the economic fallout of rising unemployment. So here we have, on the left-hand side of the screen, we have statistics of before the pandemic in 2019, Chicago households that were already rent burdened. So rent burden measures the number of people who spend more than 30% of their household income on rent. So here we see that before the pandemic, 52% of Black households and 60% of Latinx households spent more than 30% of their household income on rent. Then on the right-hand side, we see how people used their stimulus checks. This illustrates how only 10 months into the pandemic, people were already so indebted that they were just trying to keep up. People that we spoke to were trying to juggle food, rent, car payments, childcare, and they were falling further and further behind. Rental and cash assistance programs were made available after vulnerable residents had begun to accrue this kind of debt. By that point, residents had already put themselves and their families at risk by continuing to work due to financial and housing insecurity. If financial and housing vulnerability was treated as a public health risk for the poor, then policies would have attempted to preemptively protect them from housing and financial precarity. But this did not happen. And this brings us to our third explanation for the discrepancy between policy and impact. The COVID-19 response prioritized middle-class Americans and the protection of the economy over keeping the vulnerable safe. Businesses were given extensive federal funding, and cities, including Chicago, rushed to reopen the economy while many residents were still in crisis and struggling to cope with pandemic vulnerabilities. Labor protections and paid sick leave were not prioritized, which put poorer Americans at risk of infection at work. Middle-class Americans were able to work from home because poorly paid workers continued to labor in factories, shipping warehouses, meatpacking plants, agricultural sites, and along delivery routes. A health provider we interviewed who works at a federally qualified health center in Albany Park told us, our patients were doing construction, housekeeping, working in grocery stores, factories, Amazon. They were in jobs with very few rights as workers. They had employers putting them in harm's way or not letting them follow safety precautions. They didn't have the option of complaining. It was either they did the work or they got fired. In these marginalized groups, there are very few options to speak up and advocate for yourself. So we had a lot of patients who were coming in that were sick and they were getting it at work. I feel like people were trying to be as safe as they could be. The fourth explanation our research provides for the failure of existing policy to meet existing needs is that there were multiple problems with the way that social assistance was made available during the pandemic. As we detail throughout the report, multiple social assistance strategies were utilized by federal, state, and local governments, including stimulus payments, increases in unemployment, and rental assistance. But at best, we found that these social assistance efforts offered minimal harm reduction when more extensive resource allocation was necessary to offset structural inequalities. Further, financial and housing support was offered in a reactive fashion, as I've already explained, after residents had already experienced mounting debt, job loss, and financial insecurity. On top of that, residents often faced bureaucratic barriers in accessing financial and housing support, or payouts were extremely delayed. In Chicago specifically, there were primarily two different kinds of aid that were given to vulnerable residents. Testing, contact tracing, and vaccine programming, and then emergency cash and rental assistance programs. Early in the pandemic, when it became evident that there was an uneven toll on racial minorities in the city, Mayor Lightfoot initiated the Racial Equity Rapid Response Team, or RERT, which brings together city officials, epidemiologists, health providers, and community organizations in areas of the city that were very hard hit by coronavirus infections. Using epidemiological data on infections, hospitalizations, and deaths, and when available vaccine uptake, these stakeholders designed testing and then vaccine drives in certain vulnerable communities. So in this slide, we see on the left-hand side, the Racial Equity Rapid Response Team and the 6 communities that were targeted for additional investment. And in the beginning, these 6 communities, Belmont Cregan, Austin, Pilsen, Little Village, South Shore, and Auburn Gresham, were given educational programming, testing and contact tracing, and also some food insecurity support. So these 6 communities were initially a part of the RERT, or the Racial Equity Rapid Response Team. So 6 of these communities were chosen to participate in the RERT, and once vaccines became available, then 15 communities were targeted, and that's what's listed on the right-hand side. So this is the Protect Chicago Plus project, which targeted 15 of the most vulnerable areas for vaccine distribution and programming. But we found that not only did this design to some degree pit communities against one another, but even within these chosen communities, we found in our interviews that many residents still struggled to access testing and vaccines. So with housing and financial support, so that was sort of that sort of explains the way that the city kind of approached its vaccine and testing resources, how it extended resources to vulnerable communities. And now I'm going to turn to the housing and financial support. So with housing and financial support, residents had to demonstrate that they were already vulnerable before resources would be allocated. Implementing social benefits through means testing, where the burden rests on residents to prove their eligibility, is part of at least a decades-long tradition in the United States designed to prevent any possible attempt to defraud the system. Implemented in this way, social benefits include complex and cumbersome requirements of bureaucratic proof to access. And this creates tremendous barriers for the most vulnerable. Barriers include language, technology, and computer obstacles, short windows of time to produce proof, delayed delivery of funds if applications were accepted, and obstacles associated with childcare and work schedules. This slide indicates all of the different status descriptions of the emergency rental assistance program. This slide shows the number of households that are estimated to be behind on rent payments in Illinois. So that's 299,203 versus the number of applications that have been approved, which is on the right-hand side, and the applications that have been fully reviewed and paid out, which is only 57,013. In addition to the bureaucratic obstacles that bureaucratic and other kinds of barriers that people faced, tenants also had to rely on their landlords to be willing to provide documentation. For one particular Latinx resident from Albany Park, this became a barrier. He explains, "I don't have legal documents, and it's very complicated to get any kind of support because we didn't get the stimulus check. Also, they wanted me to talk with the landlord so they can send him the rental assistance. The problem is that the homeowner doesn't want to provide that information that they're being asked for because the homeowner has to give their tax number." Another Latinx man from Little Village explained all the bureaucratic barriers that people faced in filing for emergency rental assistance. There were a lot of different deadlines with a lot of documentation required to get housing assistance. For rent, you needed to show contracts signed by the landlord. A lot of families don't necessarily enter those contracts. They pay by month. So getting certain documents and getting them in a short period of time before the money ran out or before the application period quit, that was a barrier. So again, although there were 299,203 households that are estimated to require rental assistance in Illinois, only 111,356 applications have been reviewed, and only 57,013 have been funded. So clearly these funds are not being dispersed efficiently and do not meet existing need. Further, they have been so delayed that many residents have already lost housing, been illegally or informally evicted, or chosen to move rather than face formal eviction. In sum, then, instead of the government designing policies to keep poor people safe, which would have included canceling rent, offering paid sick leave and work protections, and providing cash assistance and free medical treatment across hospital systems, it forced poor people to expose themselves to dangerous infectious situations at work, in public spaces, and at home, so that middle-class Americans and business profits could be prioritized. The racial equity measures put in place by stakeholders involved in the Racial Equity Rapid Response Team were in some ways hugely successful. Epidemiological data was successfully deployed to direct testing, contact tracing, and vaccine programming and resources to vulnerable areas of the city. In addition, the city employed a hyperlocal lens that drew on community organizations' local knowledge and connections to achieve community trust. As a result, City of Chicago officials were able to track positivity, hospitalization, and deaths at census-tracked levels and respond to surges and outbreaks with local supplies. Further, Chicago officials fought to achieve equity in vaccine distribution once vaccines were widely available. And these are laudable achievements. And yet, as we explain here and in the report itself, the city was unable to successfully meet the extensive needs of vulnerable Chicagoans who already faced pre-existing structural inequalities. The city utilized a scarcity framework for allocating meager resources and prioritized certain kinds of vulnerability and certain communities over others. Resources were therefore triaged in ways that often rendered broader structural problems invisible or unaddressable. Thank you.
Thanks so much, Claire. We are, just to remind everybody, if you have questions along the way, please drop them in the Q&A function. We are thrilled today to have several colleagues who are going to join us in this conversation. Anytime we do one of these reports, we recognize we can't cover everything, and we are so glad to have partners who can fill in gaps and add to the important conversation going on. I'm going to introduce them all here, and then we will go in order. First, I want to offer regrets from Dr. Ana Guevara, who was going to join us today. She wrote an essay in the report, which I encourage you to read, about the way that the pandemic impacted care workers in the city, and particularly Filipino healthcare workers, but she won't be able to join us. We will be hearing from, instead, three wonderful colleagues. First, we will hear from Dr. David Stovall, who's a professor of Black Studies and Criminology, Law and Justice at UIC. His scholarship investigates three areas: critical race theory, the relationship between housing and education, and the intersections of race, place, and schooling. Next, we'll be hearing from Dr. Linda Ray Murray. She's on the faculty in Health Policy and Administration in the School of Public Health at UIC. She spent her career serving the medically underserved. She's worked in a variety of settings, including practicing occupational medicine at a workers' clinic in Canada and serving as the bureau chief for the Chicago Department of Health under Mayor Harold Washington. She is past president of the American Public Health Association and has been a voice for social justice and healthcare as a basic human right for over 40 years. And then we will hear from Dr. Nick Theodore, the department head of UIC's Department of Urban Planning Policy in the College of Urban Planning and Public Affairs at UIC. His work focuses on economic restructuring, labor standards, and worker organizing. His research has appeared not only in a number of academic journals, but in a wide variety of public outlets, including New York Times, Wall Street Journal, Chicago Tribune, Washington Post, et cetera. And each of them will talk, and then we will have a kind of moderated Q&A to follow. So first to Dr. David Stovall. Thanks.
Peace and greetings, everybody. Thanks so much for having someone like myself to take part in this. And thank you, Claire, for giving us that overview, because I think it's really important to situate how we look at something like schooling. And one thing is important, and I want to say to everybody who's in the audience, thank you all for surviving the three pandemics of white supremacy, capitalism, and COVID-19. We're talking about COVID, but the other two pandemics are critically important when we understand disparity. When we think about education, I think it's important to put it into focus. And the thing to put into focus is what was happening before COVID. So when we think about Chicago Public Schools, one important data point that I think is important to be shared, and it's in the report, is that 60% of all CPS students accessed the internet outside of school by way of their phone. So now if we think about that particular dynamic and what that means and what that limits you from doing, now when you think about COVID and those spaces being shut off in terms of not having access to the school building, not having access to the libraries, which, by the way, only gave you 45 to 1 hour time limits, depending on the library, to be on a computer. So any computer-based work was next to impossible. So, and this is before COVID. So now if we think about during COVID, not having access to the building, not having access to the library, you now think about what does it mean for the young folks who have been in those situations, who have now been extensively limited in their access to teachers, to viable food options, even though there was some food distribution in schools. And now thinking about, when we think about those folks who had the least access, they are also the people who are in the neighborhoods that had the least access to healthcare, the least access to food, and the least access and the highest losses of employment. So now when we think about COVID and how it's hit Black communities in particular and Latinx communities, we now have to think about a city that has demonstratively demonstrated who has been valued and who has been made disposable. But the most important thing, I think, is to understand that that disposability was happening pre-COVID and has only been exacerbated by the health pandemic. So when we think about school space, it's not viable to ask a young person who may have been accessing school, internet on the phone, to now have that as the main source of their interaction with anybody at the schoolhouse. And what that does over time is that it disconnects folks from schools, because we already know how limited handheld devices can be in terms of doing the things that are required on a desktop or a laptop. So now if we're asking 5-year-olds to engage in a space where there is no access, then they quickly disconnect. And this becomes important as young folks get older, because as Claire mentioned, many of these young folks became primary breadwinners in their households. So now school does not become a viable option when it is really the survival of the family that is taking precedent. And I think this becomes important when we look at Black and Latinx communities in Chicago, because if we look at the history of school closures pre-COVID, we will also see similar issues in those neighborhoods in terms of lack of infrastructure, lack of access to employment, lack of access to healthcare, and then a depleting public educational body that has now made it even more difficult for folks to access it. And this becomes a question where we can actually visualize and see that particular disparity. And I think it's really important to put forward that COVID was just this intensifier, right? We were in a situation already, depending on where you lived in Chicago, in terms of education, healthcare, employment, relationship to law enforcement. This has only kicked up what we have already known. And now I think it becomes critically important to say what has happened, and I won't call it a silver lining because I think that's a little too cliche, but I think what it's pressed us to consider is that there are new ways of doing, and the things that we have relied upon, particularly in school spaces, now need to be revisited, especially around assessment, when we think around grading, especially around making sure that folks have access to infrastructure, and really understanding, and I know Nick and Dr. Murray will talk about this more, but how we even understand mutual aid and how that works in ways that people have been doing before COVID that we now need to center in thinking about a redistribution of those particular resources. And schooling has just put us on notice that these things are not only reticent to particular communities, but it is now a citywide concern, because that 60% of young folks who did not have access outside of school spaces to internet infrastructure are now, we're seeing, entering the criminal legal system. And when we start to think about this particular understanding, and if we put it, and this isn't in a report, but if we think about the age grouping of folks who have been involved in carjackings, and you see how young they are, the question becomes, where was the disconnect, and how that disconnect was exacerbated by COVID. So now we're thinking about it. It pushes us to think about things differently. It pushes us to think about the possible solutions differently. And it always challenges us to understand that what we are really up against is a process that has valued some residents of Chicago and have made many Black and Latinx residents disposable. And I think when we are clearer about that, our commitment to solutions become different. Thank y'all.
Thanks so much, David. Dr. Murray, going to you now.
Good afternoon, everyone. I want to start off by seconding what Dr. Stovall said. This pandemic should not be a surprise to anyone. And what we see in this report is a result of capitalism, racism, and fundamentally not providing what human beings need to survive and thrive in our society. So let me just say, as a physician, that this is not the first pandemic, certainly, that's taken place in my lifetime. I know it's gotten more press because it truly is worldwide and has been devastating with a new virus. But we had the HIV pandemic, very similar in many ways. We've had other pandemics, SARS, H1N1. We have had a number of pandemics. And let me just say at the very beginning, before I go into what this report talks about, in large measure, the frequency with which we're seeing these massive worldwide pandemics is a result of climate change. I don't want us to forget that it's a result of the impact of human beings on messing up the planet. But let's leave that aside for the moment. The second thing I would like to say is that this report, I think, details what I think most people in Chicago know, but we have to be careful about how we think about this. So in America, unlike the rest of the world, we tend to think of medicine and medical stuff as what happens in an exam room with a provider, what happens in a hospital. That is not what health is about. So if you had asked me 10 years ago, before COVID-19, was housing a health issue, I would have said, of course. If you don't have decent housing, you cannot be healthy. If you don't have appropriate food, you cannot be healthy. If you don't have a good school system with playgrounds and recreations, you cannot be healthy. So what we saw in the report is not even just unmasking of these problems, these lack of resources, the lack of support for human beings makes people sick. More importantly, before COVID, it kills people earlier than they should die. So people suffer more and they die at younger ages from diseases and health problems that ought not to exist if we had a society based on justice. So what happened with COVID, then we had, let me just say, I want to say something good about our government, especially when you compare it to some other states in our country. Our state, county, and city health departments, crippled though they were, stood out. They were one of the first in the country to actually track this pandemic by race and ethnicity, unlike many other parts of the country. We don't really do it by class. I would love to see that because that's also a major factor. But ignoring that, we should ask ourselves, what was possible to be done in the middle of a forest fire? That's really what we're talking about. When we say we don't have an infrastructure, what can you do while a fire is raging down to address the fact that your tertiary care, big time hospitals are not equally distributed in the city? Why is that important? It became even more important with the vaccine because you need specialized freezers just to keep the vaccine. You couldn't just put it in any doctor's office at that point in time. So the lack of infrastructure is a positive, not positive in a good way. It's an intentional decision on the part of the power structure of this country to not have an infrastructure, to not have the resources and institutions necessary to support human life. It's not an accident that we were down at least 250,000, 250,000 public health workers when the COVID-19 hit. We had lost that many just in the previous 10 or 15 years. When the city went out and tried with to highlight certain communities to get extra, quote unquote, extra resources, the resources were never enough. They weren't enough for anybody. So even though it sounds like, because we're talking about billions and billions and billions of dollars that government has spent in this time of crisis, but if you ask yourself how much money was needed, I can tell you it wasn't enough. We didn't have enough healthcare workers. We didn't have enough housing support, rental support. If we had a rational country, housing is a basic human right, and people would not have to spend 30% or 50% of their income on housing. And when they became unemployed, they wouldn't be evicted out on the street. So we have fundamental structural problems in this country. We value, I don't think the problem is simply that we valued middle-class needs over marginalized communities' needs. We valued profits over human needs. So the decision to support the airline industry and make sure that they kept their profit margin, rather than making sure that everybody in this country had a place to live and everybody in the country had food to eat, that's the decision we need to be challenging and really protesting against and organizing. So we shouldn't allow our eyes to be taken off the ball here. The real problem is we don't have a rational country that supports human life. That's the real problem. And the value system that we implement is one that denies human life. That's why bureaucracy exists. It doesn't exist because government workers want to do extra work. It exists because we are so afraid that one penny go to somebody that the ruling structure doesn't like. It's really easy to say we shouldn't charge rent in this time. We should suspend mortgage. We should suspend mortgage payments, because if you don't charge rent, and the people who own these buildings, many of whom are working class people that own a 2-flat or a 3-flat, you don't get rid of mortgage payments, then those people lose their property. You have to go to the root of the system. So I think that has to be our call. I want to remind people that in all of the worldwide pandemics, it has shaken the economic structure of the world. In fact, some people argue that the bubonic plague, the Black Plague, was one of the reasons that feudalism had to change, because they lost so many people that the serfs tied to the land were able to demand something. And it's not an accident today that we see an increase of union organizing activity, and people are complaining that they can't find workers. That's because the power has shifted a little bit. So I want us to ask ourselves, what can we do locally at a state level, and then nationally, and more important, internationally? What can we do to begin to demand changes in the system, not just more food for our kids or more computers for our kids? How can we take control of these critical institutions and say we should have an education system that raises and nourishes and supports children? That is a revolutionary thought. But if we don't have that, the next time there's a pandemic, and there will be a next time, those kids will suffer again. We should be asking that at every level. The reason that we're faced with a new variant today is because we have done what we've always done: put profits before people. So if you don't distribute the vaccine the way we planned to, the way we agreed upon 10 years, 15 years ago, to slow down the spread of a pandemic like this, when we protect the ability of these companies to make profit off of our research, public's research to begin with, then we guarantee that millions of more people around the world will die, and that we'll have many, many, many more variations with this pandemic as it spreads around the world. So we are really faced with the things that we are always faced with. We're used to this. The fact that we have a virus as one of the initiating factors at this point is almost an accident of timing. The basic problems that existed that are causing people pain, suffering, and death are still there. And if we're not serious about understanding that all of this is public health, And when we say we don't have a public health infrastructure, what does that mean? We don't have paid sick leave. We don't have rent control. We don't have guaranteed education. We don't have a guarantee to water. We don't have a guarantee to housing. The things that the rest of the world thinks are basic human rights in this country, we deny to our population. And until we address that fact and leave our individual silos and understand that health is an education issue, housing is a health issue, that all of these things are connected, then we'll be faced with the same problem over and over again.
Thanks, Dr. Murray. That's a lot to think about. And I have a few questions. I'm going to hold them till the end. Now we're going to turn to Professor Theodore.
Right. Thanks, Amanda, and thank you for inviting me to join the discussion of this important study. As Claire, Dave, and Linda Ray Murray explained, the pathway the pandemic has followed has been powerfully shaped by pre-existing structural inequalities and racial disparities. We see this vividly, not just in Chicago, but across the country. We see this in rates of infection, in rates of mortality, in the spread of social insecurity. And here I'm talking about food insecurity, housing insecurity, income insecurity. And as the waves of the pandemic continue to rise, fall, and rise again, its impacts have lingered in certain communities far, far longer than in others. The report authors write that Claire and her colleagues write, racially marginalized Chicagoans continue to experience disproportionate health, housing, and financial insecurity. This is one of the reasons the authors have called the COVID-19 pandemic more than a medical crisis. The report authors point to an inescapable fact, that in this highly segregated city, the burdens of the pandemic continue to disproportionately fall on Black and Latino communities. In mentioning this, I'm not telling you anything that you don't already know, but I think it's worth repeating as a starting point for uncovering some of the pandemic's more hidden impacts. It's worth repeating because we probably shouldn't blame some of the impacts we're seeing solely on the pandemic, because the underlying conditions, to borrow a medical term, the underlying conditions were there all along. Well before the COVID-19 pandemic shuttered much of the US economy, countless Chicagoans were living on the edge. The regional job market has been transformed over the past several decades through a series of recessions and recoveries that saw massive employment losses in manufacturing and the rise of a sprawling low-wage service sector. Reliance on poorly paid service jobs has deepened in our city, and many workers depend on gig work to supplement their earnings. Others, however, haven't even been so lucky. So the side hustle, work in the informal economy, it's that side hustle that's become their primary source of income. Here in Chicago, the organization Equity and Transformation has been shining a spotlight on the informal economy to reveal the reasons why it's so prevalent in African-American neighborhoods. Our joint research has shown that stubbornly high unemployment rates in Southside and Westside communities have pushed many Chicagoans into informality. Living in neighborhoods that have been hollowed out by deindustrialization, inadequate investment, and economic development programs delivering too few jobs and business opportunities, well, many residents have resorted to working off the books in order to make ends meet. Working as street vendors, selling loose cigarettes, food, or personal care items, working as babysitters or movers, or auto mechanics back in the alley. Chicagoans who are unable to find regular permanent jobs are relying on the city's informal sector. Now, you might be thinking to yourself, hey, what about all the help wanted signs I see downtown? Many of those who are working in Chicago's informal economy face exclusions from jobs in the mainstream labor market. Some have employment histories that are scarred by spells of long-term unemployment or the mark of a felony record. Some are coping with significant health challenges or have disparities that impact their employability. Still others have caring responsibilities inside and outside the home, so they turn to informal work to make ends meet. There are many routes into informality, but it seems there are very few routes back out. The pandemic has exacerbated the economic problems facing residents in Chicago's poorest communities. It's caused unemployment to soar even higher than it had been in Black neighborhoods, testing the capacity of Chicago's informal economy to support not only the existing participants, but those who are newly out of work. The number of participants, both as buyers of low-cost goods and as sellers, that number has swelled as households endure the repeated financial blows of an economy on lockdown. It's worth noting, I think, that the epicenters of Chicago's informal economy are the very same South Side and West Side neighborhoods that witnessed massive job losses decades ago and escalating mortality from COVID-19 today. As the report authors have shown, vulnerabilities rooted in societal factors such as poverty and discrimination are closely tied to geography in this divided city, as well as to risk exposure to the ravages of the pandemic. Together, these vulnerabilities, which are rooted in pre-existing structural inequalities, these vulnerabilities have produced the disparities we're witnessing in COVID-19 outcomes. These factors also contribute to the likelihood that the long-term unemployed will have to subsist through informal economic activities. And together, they contribute to the problem of entrenched poverty in Chicago. The pandemic has laid bare deep socioeconomic divides in this city. We see this in the research findings Claire presented in this webinar. Meanwhile, the research conducted by Equity and Transformation has revealed that well after the pandemic has ended, the grim economic realities of South Side and West Side neighborhoods will remain. We faced a lot during this pandemic. There's no question about it. The economic realities that Equity and Transformation are highlighting are something that Chicago and the rest of the state will finally need to face when this pandemic is over. Thank you.
Thanks so much, Nick. I want to start, I have so many questions for all of you, but I want to start with a question for everyone, and you can decide who takes it first. And it comes down to something that several of you raised. David Stovall talked about it as the way that the pandemic just intensified already existing crises. One of the things that we talked about a lot here from our first report was that if you look at the unemployment rates across the city of Chicago, when we published our first report, it was not too long after the big housing crisis, where suddenly there was this big crisis in the country, and you could see it in unemployment numbers. But if you looked carefully, this supposed big crisis in the country around unemployment, white unemployment numbers then were still lower than Latinx and Black unemployment rates had been for decades, right? So that some of us are living in a constant state of crisis in many ways that never gets recognized. And I think that's part of what David was labeling when he talked about the politics of disposability, or what Linda, what you were pointing out when you talked about the kind of causes of premature death, or the years of lost life that result from inequality, and how things would look different if we lived in a society that actually took care of human beings, and in which we thought about ourselves, as kind of responsible for taking care of everyone. So this leads me to the question that early on in the pandemic, there was a sense that some things were going to change. Like, I know one of them that's in my area a lot is that there has been a shift in some ways away from a dependence on standardized tests, that there's some things that happened during the pandemic that maybe we're holding on to a little bit, that maybe shift things a little bit for the better. And I'm just curious about what you think we've learned, if anything, and whether the crisis has in any way been an opportunity to shift how we do things for the better. I think, Linda, you already mentioned this a little bit in terms of the intensification of union organizing recently and some of the wins there, but are there other things that you see that are things that we either are holding on to or should be holding on to that may be changed during this moment? And whoever wants to go first.
I think the opportunity is always there. But I think we have to be clear. So let's look at what the example you brought up, standardized tests. yeah, I'm very glad to see, especially at the collegiate level, that a lot of these entrance exams are being eliminated. But it doesn't really help if students enter these institutions and don't receive the support they need, especially when they're coming from inferior education systems to begin with. So I think the hope I have is that ordinary people look around and say, things don't have to be that way. For Americans, for example, I hope they're paying attention to what's going on in the rest of the world and their response to this pandemic, to understand that in large portions of Europe, for example, the level of support is much higher. Of course, that's true on an everyday basis, pre-pandemic also, but most Americans don't pay attention to that. So I think that what we can learn from here is that another reality is possible if we are willing to join together and fight for it. That to me is the biggest hope I have after this pandemic. But these small changes, these superficial changes, I think they're important, but I don't think they solve the problem. Look at the earned income tax credit, which has raised 40% of kids out of poverty. But if we don't do that, if we don't do something to make that permanent, then when that goes away, it's going to happen. So we're paying attention to these Band-Aids, we're avoiding the deep-seated things. Why do we still have an electoral college? Why do we allow voter suppression to occur? If we don't solve those problems, then we'll lose the vote on all of these other superficial and important, but still superficial changes in terms of money for various things that should have always been there.
I can say a few things about this as well. Thank you so much, Dr. Murray, for your comments earlier, and for those as well. I think they're so profound and important. We asked people, both the kind of experts that we interviewed as well as the residents, what they saw as sort of some of the enduring legacies of the pandemic. And many of the experts that we spoke to saw at least some positive things in the sort of massive investment of funds into public health departments. They really saw that as a capacity to do some real change, to really begin to try to address some of the social determinants of health. Many of them also found the sort of involvement of community organizations in the city's response as a real positive step in the right direction, and really see a lot of kind of hope for what might be possible moving forward, given the light that's been sort of shed and the sort of infusement of funds. However, when we spoke to residents on the ground, many of them said, we would ask do you think that the pandemic has changed race relations or made them more visible in certain ways? And many of them said, no, it's just the same thing as it's always been. And kind of using the words that you used, Amanda, we've always been in crisis and the crisis has just been sort of exacerbated. And many others also talked about how they felt like racism is worse in this country now than it has been, in part because of all of the sort of what happened under the Trump administration, but also just feeling like the politicization that has occurred with COVID has created race conditions that are in some ways much more difficult. So I just thought it was interesting to kind of hear the difference. And I think, I'm not saying one is right and one is wrong or anything like that, just the sort of differences between the way that respondents sort of residents sort of answered that question, especially racially marginalized residents versus folks who are working in public health arenas.
I don't know what public health, I'm sorry, Nick, but I just, as a public health person, that we have seen no major increase in supporting the public health infrastructure. Just because all this money has flowed in, it goes away in a year or two, depending on which phase of the grant you're in. So you can't hire people and then they're gone in 2 years. That's not helping the infrastructure. So I think we make a mistake. Do we have funding to make sure that the class size in public schools is 12 for the next 50 years? No, we don't. So I really meant it when I said we got pennies during a crisis. Now, when you're poor, pennies look like a lot of money. Don't misunderstand me. And I'm glad we got those pennies. But we should be clear, it's nowhere near, by order of magnitude, it's nowhere near what's needed for even the basic social net, safety net. So I just think we have to be really careful. And I'm a government worker. I worked there for decades and I know what happens, but I also know this was a major problem for our community organizations and public health departments. All of a sudden, you're doubling and tripling your workforce for a year or a year and a half. It's a very bad way to set up things.
I was just going to pick up on something that Linda said as well, that it does seem in this moment, when we look about the legacy of this pandemic, it seems that in this moment, workers are finding their voice, workers are finding their power. And some of it, I think, goes back to something Claire said at the very outset of the pandemic when she quoted one of the residents and quoted the resident about the indignity of, on the one hand, being told that they're an essential worker, and on the other hand, seeing the disposability and the way in which the employer regarded them. And so that disconnect, I think, has come home with particular force in a way that we have not seen at this scale ever. And I think it's something that has left its mark on the labor market. Where this goes, I'm not completely sure, but we can see at this moment, as Linda was pointing out, whether it was Striketober or whatever, their workers are finding their voice and finding their power and questioning the disposability with which many employers have regarded them.
I'm curious, I'm going to sort of bring in one of the questions, but I also want to ask all of you, there's so much important organizing, several of you have alluded to the important organizing going on in the city right now around a bunch of these issues. And I know, Claire, you spoke to a bunch of community organizers while you were doing this research. And I'd love to hear you all lift up some of those organizations and talk about some of that work that's going on right now, because I think that's where some of us see like the possibility for some real change. And I'll just throw in here also, if anybody wants to talk about it, there was a question raised in the Q&A about why this moment hasn't led to a stronger organizing movement around single payer healthcare. Why are we still linking healthcare to employment when it so clearly doesn't match our needs? So Nick, why don't we start with you, because you're front and center on my screen, sorry.
Well, you know, I think one thing, and Dave mentioned it before he had to leave, was the kind of grassroots explosion of mutual aid that we've seen across the country. I'm just finishing a project for Hispanics in Philanthropy, looking at mutual aid by Latinx-led and Indigenous-led organizations across the country. And it's been quite remarkable how these organizations pivoted in the middle of a public health and employment crisis, pivoted to direct service, because these were not service organizations. These were workers' rights organizations. These were cultural organizations and other things. But because of the incredible community need, they pivoted into direct service. And I think it's led to a rebuilding of relationships within community. It's led to a valuing of organization within communities that I think becomes a platform for dealing with some of the public health issues, some of the education issues that Dave was talking about, some of the employment issues that Claire and I have been speaking about. I think it's an amazing groundswell that I think is another possible lasting effect of this pandemic. Equity and Transformation, who I've talked about, also moved. They had not done mutual aid at this scale, but was doing all kinds of work in the West Side to deliver food, medical resources. In other parts, in Los Angeles, in Omaha, Nebraska, you have organizations that were doing vaccine pop-up clinics. I mean, this was not anything that they had ever contemplated, but through a mission-driven move to respond to community needs, we've seen the incredible resourcefulness and creativity of community-based organizations rooted in communities, responding to the multiple crises that we've been talking about.
Linda or Claire, want to throw anything on there?
Well, I think the question you ask is an important question. And it's really a question of, how do you have a revolution? That's really what you're asking. How do you organize people to fundamentally change the structure of the country? And I came of age in the 60s. And we have times where the general public pays more attention to the organizing efforts go on, but really organizing goes on all of the time. If you have a tornado or a hurricane, you're right, people will pivot depending on what the community needs that they're working with. And so I would say, as I consider myself an organizer, I would say our challenge is as organizers to find a way not to stay in our organizing silos. So if we're organizing on housing, we have to find a way to break out of that silo and be aware of what's going on in other issues. Find a way to ask ourselves, how do we have a movement, a process that lasts decades? Because this is not going to be solved in, a 30-day action or even a year or two strike. It really means organizing and building institutions that fight for human rights over years and over decades. But I do, and don't confuse attention on the TV with the fact that there's something. I do think there's more organizing going on today. I don't want to belittle it, but it's always going on. Look at the General Iron situation around environmental racism. Well, Chicago has that community, for example, they're one of the founders of the environmental racism movement. And this has been going on for over 30 years in that community. So they didn't just pop up. The fact that General Iron happens to be the latest issue doesn't erase the fact that there's a 30-year history. Look at Pilsen Little Village. So we have these organizations and movements going on all of the time on all of these issues. And our challenge is to help connect them up and see the connections between them and really take our organizing efforts to a higher level, because we're still losing over the all in the broad sense of the word.
All right, I want to bring in one of the questions that was sent in. I'm just going to read it, and I think Claire and Linda, this may be for you. A quick review report doesn't appear to include any mention of increasing oral health problems associated with diet, general health, and immune health suppression. This is somebody who said oral health in our study cohort from Miles Square indicated a burden of viral and bacterial infection becoming enhanced with COVID-19 infection, and probably contributed to incidence and death rate in this population of racial disparities. I think, can either one of you speak a little bit to the kind of existing health disparities and how that played out in this moment?
I was waiting for Claire.
Sorry, I was just trying to read the question. I don't really know. Yeah, obviously we did not talk to people about their oral health or anything like that. Yeah, I do think that there was massive food insecurity. That was something that, and even today, so we're continuing to do some follow-up interviews with some of the residents we interviewed in the first year. And many of them are still wholly reliant on pantries that were established. And one thing I think that's been really revealed by this pandemic is that our food insecurity is profound and it's not addressed in any kind of real way. And it's sort of like pockets and fragmented sort of systems that are available to folks. And, obviously it also shed a real light on the fact that, a lot of the frontline workers were also continuing to work in agriculture and meat packing in order that other people could, continue to eat. And so I just think that the food security issue really came to light during the pandemic. And I just know that a lot of the folks that we've been speaking to really recently have been really angered by the fact that it seems like, maybe Omicron will change this, I don't know, but have really seemed like the country is sort of saying, like unemployment ended in September, the advanced unemployment payouts ended in September. A lot of the rental assistance programs are coming to an end. The rent moratoria the eviction moratoria are coming to an end. And a lot of the residents we've been speaking to lately are saying, wait a minute, the vulnerabilities are still very much with us. Like, why is all of this ending now? It's way too soon to end even the, meager support that Dr. Murray was talking about that people really came to rely on. And so, I think food insecurity is one of those things, and that the people that we're talking to are still accessing pantries. So this is an ongoing, that doesn't really answer the oral health question, but it does get to the sort of broader question about sort of food access and that exacerbating existing difficulties people are having, and including health issues.
Well, as I'm sure the questioner knows, we always ignore oral health. So again, this is a fundamental problem we have in our society. Your mouth is part of your body. And so why we make this distinction of demeaning oral health and mental health, behavioral health also. We don't insure them at the same rate. We don't reimburse them at the same rate. We don't have the same level numbers of providers for this. But it's an example, and the same thing with the question about single payer healthcare. It's an example of how all of these issues are tied together. And so those of us that care about oral health, we should find a way to enlighten people how COVID impacted that, but also connect up with these other problems. The same thing with single payer. Yeah, we remain the only industrialized nation without universal medical care as a guarantee, and we should be embarrassed by that. And so we should just understand that our country, we have the worst medical care system in the rich world. And our rich people, let me defend our rich people for a minute. Our rich people have much poorer health than rich people in other countries, in other rich countries, Japan, France, England. So the reality is the problems that we have here, the injustice that we have here impacts everyone. It doesn't impact everyone equally, but it does impact everyone in the whole society. And that's why we have to fight racism. It's a hierarchical system. It harms everyone, harms people of color more, but it harms everyone. And so we need to find a way to express our outrage in a way that connects up with other people's conditions. We haven't talked here, for example, I didn't expect this report to do this, but one of the places that's hit most by this pandemic has been rural America. They have fewer medical resources, fewer ICU beds. They are under-vaccinated. And I want to reassure people, we are not over. I'm not even confident that we're out of the first half of this pandemic, and this new variant is just one example of that. There's no reason for us to believe that somehow we're on the downslope of this worldwide pandemic. There's every reason to believe that we're still on the upslope of what's going to happen with this. It's unpredictable, but we really have to be aware of that.
Nick, there was an interesting question in the chat about mutual aid, sort of saying it was both really wonderful to see communities stepping up, but wondering whether some of those mutual aid efforts took pressure off city and federal authorities for doing what they needed to do to take care of communities. And the sort of question is, how do we keep the pressure on?
I mean, it's a great question. And it's one of the contradictions, I think, of these kind of grassroots efforts. At the same time, if you just look at the immigration policy in this country and the public charge law, which was enacted just a week or two before the pandemic was first recognized in the United States, public charge law saying that if you're an immigrant who would like to regularize your status, if you have availed yourself to any of the public assistance, even the public assistance that is available to you by law, you might be deemed a public charge and it would hurt your case. Well, much of Claire's report focuses on the illogics of public policy and their failures. This is one of the greatest single failures during the pandemic of a Trump era public policy that has devastated immigrant communities. And so in the absence of that, in the context of something like that, I think it was natural that there would be a community response faced with the absolute need that so many residents and families were facing. Did it take some of the pressure off? I think it did. But in the context of short-run suffering, I was impressed by civil society, non-governmental organizations stepping into that void to try to help. So, I'm moved by that, even as I realize that the pressure that we've been talking about needs to be maintained.
I think it does beg the question, if I can just say something really quickly about funding, though, because a lot of the funding that was being trickled down into community organizations sort of deputized those organizations as kind of like city organizations, which then a lot of residents didn't trust. And so I also think that distrust in the government is at a really big high. And so these mutual organizations that are not connected to sort of funding streams, it's just a really complex problem, I think, because at the same time, the coming together of communities is super important and people survived because of it. But at the same time, distrust of sort of funding coming through the government to some of these organizations has also been pretty profound. So
But I think in the cases I'm talking about, there was no government money coming to the organizations. This was grassroots fundraising. It was some philanthropic support. And, you know, in the case of the National Day Labor Organizing Network, just to name one, I mean, through grassroots fundraising, they raised $4 million that then went through the network to worker centers across the United States to assist predominantly Latinx immigrant communities. And so they moved faster than the government. They reached deeper than the government, and only now is some of the government support catching up with what the NGOs had done.
I keep being struck in this conversation at how much the kind of policies that are getting implemented don't reflect people's realities in terms of the reality of informal work, the reality of informal housing, and how people are managing to survive, and in terms of what we're doing to try to meet people's needs. There's an interesting question, Claire, and I wanted to bring it to you because one of the things that came out in the report a little bit is, you know, people think of Albany Park in some ways is a kind of better off community than maybe Austin and Little Village, but the death rates in Albany Park were really high. And there was a question that came in about whether you could talk a little bit about Albany Park. It wasn't a target of the city's relief efforts. It's a pretty kind of complicated story, but if you could just give a little attention to what unfolded there.
Sure. Yeah. Albany Park is a really interesting, it's one of the most diverse neighborhoods in the country, actually. There's something like 45 different languages spoken in the schools in Albany Park. And so it is extremely, so there is a large population of kind of white middle class folks who have higher incomes, but there's also a large populations of different immigrants from different areas in the world. And there's large refugee populations as well. And the undocumented, there's a high percentage of folks who are undocumented in Albany Park. And so I think that diversity of experience, and especially to such a degree, like having higher income folks with folks who have no access to stimulus funds, for example, and language barriers that are more complex because people are coming from many different parts of the world, I think partially starts to explain. But we did talk to several people about how that the fact that there are such diverse immigrant groups in Albany Park gets continuously ignored in the distribution of resources. And so many mutual aid organizations, there's a mental health clinic here in Albany Park. There's anyway, that many of the sort of pressing issues that exist for refugee and immigrant populations in Albany Park don't get addressed because of the higher median income of the neighborhood. And so many of the kind of experts that we spoke to, people who do sort of grounded community work, really were distraught by the way that the city sort of prioritized certain communities for support and therefore didn't prioritize others, even though vulnerability is, of course, based on race and class, and immigrant status, not based on where, which is of course distributed in particular ways in the city of Chicago, but because of that, certain neighborhoods get sort of ignored for their vulnerability.
Thank you so much. We are almost out of time, and I wanted to give each of you a chance for one kind of closing thought. One of the things that you'd like people to walk away from this conversation with, and also to remind everybody to join us again on December 9th, when we're going to be having another conversation about the report with some other folks. The details are in the chat. Dr. Murray, if you don't mind, maybe I'll go to you first for your final thoughts.
Yes, I just want to remind people that we are still early in this worldwide pandemic, and we should not expect emergency money or emergency action to suddenly redress, in our case, 500 years of inequities. We have to use this opportunity as a chance to really see clearly the structural inequities and do the hard work to correct those.
Great. Thank you, Nick.
There was no coordination of message between Linda, Claire, Dave, and I, but what all of us emphasized, I think, is that there were some underlying conditions that pre-existed the pandemic, were exacerbated during the pandemic, and will remain after that pandemic. And so we can't take our eye off that either.
Thanks. Claire?
Yeah, and just to completely reflect what both Dr. Murray and Nick have said is, I think everyone kind of talked about infrastructure and the real discrepancies in infrastructural capacity that especially in the lack of care infrastructure, kind of writ large, not just healthcare, but more generally housing, education, those kinds of infrastructures. And so I think just recognizing that lack was really exposed, as Nick has already said, in the pandemic, and that it wasn't that deep discrepancy in existing infrastructure was not addressed in any way by sort of governmental intervention during the pandemic.
Thank you all so much for joining us. A special thanks to our panelists today and everybody for coming to joining this conversation. As Dr. Murray said, we are nowhere near the end of this, and we really do need to keep pushing hard to try to make sure that at least locally, everybody's needs are getting met, and we are functioning as a city for everyone, not just for some. We are excited to, as I said, invite you to join us again next week on the afternoon of the 9th. We encourage you to download the report and share it widely. It's available for free on our website through the link in the chat, otherwise known as irrpp.uic.edu. And thanks again. It's been wonderful seeing everybody today.